one of the most objective parameters which can be assessed to identify or predict the occurrence of spontaneous preterm births is the sonographic assessment of cervical length. What is important is it has to be done transvaginally to be correctly able to identify this parameter. The challenge and the dilemma currently is, do we subject all women to such kind of universal screening of cervical length with a transvaginal sonograph? That is question number 1. And question number 2 is, when do we do it optimally? Now, looking at the very high incidence of preterm births in the Indian population, this would be a rational approach. Do we have any evidence to support this? And this has been an AJOG publication of 2016, where a universal mid-trimester transvaginal cervical length screening program was implemented for the purpose of reducing preterm birth rates. And in this particular study, women were subjected to TVS assessment of cervical length at a gestational age of 18 to 22 weeks, where cervical length less than 2.5 centimeters was taken as short cervix. Patients who had cervical length less than 3 centimeters were supposed to be having a moderately short cervix. Now, in this large studies in which the introduction of universal cervical length screening in singleton gestations without prior spontaneous preterm birth was associated with a significant decrease in the frequency of spontaneous preterm births as less than 37 weeks of gestation, with an adjusted odds ratio which was significant, less than 34 weeks of gestation as well as less than 32 weeks of gestation. And therefore, it was concluded that it is important to screen women for assessment or prediction of preterm births. But then the question comes, can we do this examination only in these women who are at high risk of preterm births? And this also was analyzed, and restricting screening to women with high risk factors for preterm birth would miss approximately 40% of women with a short cervix and thus at risk of preterm births. So, if you look at universal screening, the number needed to screen to prevent preterm birth has been estimated to be 913, while restricted screening, if you do, 474 women with only one risk factor are screened, that would be necessary, while if they have two risk factors, 125, so 1 in 125 women will be identified to have a short cervix. It was also found that there is an association between a prior indicated preterm birth and a short cervix in a subsequent pregnancy, consistent with other data that women with a prior indicated preterm birth are at increased risk of subsequent spontaneous preterm births. So, even a previous iatrogenic preterm birth will put a woman at risk of a subsequent preterm birth, presumably as a result of a common pathophysiological etiology. And therefore, it is a good approach to do a transvaginal screening. And when do we time it? The ideal time would be around the TFA scan, that is the anomaly scan, which is the targeting imaging done for fetal anomalies between 18 to 20 weeks of gestation. So, this would be an ideal timeline. If you don't want to call, of course, the high risk mothers, I will always call them even at 16 weeks of gestation to do a transvaginal sonogram to identify whether they have a short cervix. But then that would additionally add one more sonography to a patient who doesn't have this risk factor. So, for a universal screening protocol, it would be advisable to offer such kind of a screening at the time of the TFA scan, where you can categorize women based on sonographic cervical length assessment. There are many qualms in the mind of obstetricians and radiologists and the patient herself for a transvaginal screening. But a TVS cervical screening is not interventional because the probe is just placed just inside the introitus and never goes and hits the cervix, because that only will give it a proper optimal analysis and visualization. So transvaginal sonography at the time of TIFA scan would be a better and a rational approach to screen cervical length and to predict spontaneous preterm birth.